by Billie. I'm the Director of Nursing at the Platte Surgery Center. Our facility is in the rural parts of Nebraska. North Platte's about 26,000 people. It's physician-owned with partnership with the local hospital. So we're an independent facility, for profit. And we have 4 ORs, we have 1 special procedure room, we have about 25 providers that come and do surgery there, and our surgeries range from orthopedics to podiatry to dental, pain, eyes. We have a whole gamut of surgeries that we do. Yep, we have been on HST since 2018. We use HST Practice Management, eChart, and Clarity. I think in any healthcare organization, whether it's an ASC or a hospital, there's been a push to get on electronic records. So I think that was the final straw is the government regulations and the quality measures and all of that. HST is just very easy to use. It's very easy to customize. It's just great support to get set up. So I think the ease of use is probably the wow moment for me. Staff is more efficient. From the time that the patient walks in, the information flows so the nurses know that the patient has arrived. When anesthesia goes and visits with the patient, that information is readily available. It's not on paper. You have to scramble to find. Once the patient's done with the surgery, the OR report from the surgeon is there. So I think just the continuity of care is what's great for the patient and for the staff. HST makes it very easy for chart completion. They have this outstanding tasks that are out there. So staff is instructed to go out there every day before they leave to make sure all their documentation is completed. That's helped us to be able to close those charts in a timely manner, enabling us to go ahead and build that patient chart out. Physician adoption has also been great. Our physicians are employed by the local hospital, so they have several applications that they have to use. HST is very easy for them to use to sign orders, to enter orders, and they also have been starting to put their operative record, like I said earlier, into the application. So that's been really seamless. The last thing is patient satisfaction. We're able to send our patient satisfaction surveys with the help of HST and our vendor that does the patient surveys, and send those out automatically, so it's not a manual task for us to do. I'm going to go back to the tasks. In paper chart, it's hard to track everybody down to get everything completed. Doctors are in their offices, they maybe are at the clinic or our facility once a week, so it's hard to get those charts completed. With HST, they just know that they can log in. It's web-based, they can log in from anywhere and do those completions. Customer support's amazing. Probably one of my favorite things about HST. We can log a ticket, and I've never had to call in to say that something's down because the response time is so quick. With other vendors, you usually have to call, you're waiting, you call back in 30 minutes. HST, I always have an email answer right away letting me know that they're looking into it, and then I get a personal email from one of the support techs that let me know what the issue is. If we need to have a conversation, they're happy to call me and walk me through it, but usually with screenshots and just stepping me through the process, we're able to get to a resolution. Since we've been on it since 2018, I think you get into a routine of just using the system. I would really like to have an optimization to see what we can be doing better or more efficiently with the application. I think there's a lot of features that we're not even using. We don't even know they're there. So just an optimization would be great. I think HST is just really knowledgeable about what an ASC needs. They're always on the leading edge if there's any regulatory changes, anything of that manner. They update the system right away. They update it enough, and that also is a seamless process with the update. So we have the latest and greatest what we need to take the best care of our patients.